Question 1. A client engages in hitting behavior which is maintained by gaining access to your attention. You usually say, "No hitting," or "Stop." Your supervisor implements an extinction procedure. During the first session using extinction, the client hits more often than usual. This is an example of A. Positive reinforcement, B. Extinction burst, C. Spontaneous recovery, D. Negative punishment. Answer B. Extinction burst. This question tests your understanding of a predictable phenomenon that often happens when you start using extinction. The behavior, hitting, was previously reinforced by attention. When you stop providing that attention, extinction, the client's hitting temporarily increases in frequency or intensity as they try harder to get the usual payoff. This temporary increase is specifically called an extinction burst. Positive reinforcement increases behavior by adding something. Spontaneous recovery is the temporary reappearance of an extinguished behavior later. Negative punishment decreases behavior by removing something. Seeing a behavior get worse before it gets better when you start extinction is usually a sign of an extinction burst. Question 2. You are teaching a client to make a sandwich using a task analysis. The task has 10 steps. You provide full physical prompts for steps 1 to 9 and reinforce the client when they independently complete step 10, closing the bag of chips they put with the sandwich. Once they can do step 10 independently, you start providing full physical prompts for steps 1 to 8 and reinforce them for completing steps 9 and 10 independently. This is an example of A. Forward chaining, B. Total task chaining, C. Shaping, D. Backward chaining. Answer D. Backward chaining. This question describes a specific method for teaching multi-step tasks, a task analysis. The key clues are that you are prompting through the earlier steps, and the client is completing the last step, step 10, and then the last 2 steps, 9 and 10, independently. This approach, teaching the steps from the end of the chain towards the beginning, is called backward chaining. Forward chaining starts by teaching the first step. Total task chaining attempts all steps in order each time. Shaping is for single behaviors, not chained tasks. Backward chaining is often used because completing the final step immediately leads to finishing the task and getting the reinforcement, which can be very motivating. Question 3. Your supervisor has asked you to collect duration data on a client's tantrum behavior. How would you correctly measure this? A. Count each time the client tantrums. B. Record the time from the start of the tantrum until it ends. C. Mark if the tantrum occurs at any point within a set interval. D. Record the time from the instruction until the tantrum begins. Answer B. Record the time from the start of the tantrum until it ends. This question is about applying a specific measurement method. Duration measurement is used when you need to know how long a behavior lasts. The clue is duration data. To measure duration, you start a timer when the behavior begins and stop it when the behavior ends. Counting is frequency. Marking within an interval is interval recording. Time from instruction to behavior is latency. So for duration, you simply time the behavior from start to finish. Get out your stopwatch. Question 4. Which of the following best describes the role of the RBT in the assessment process? A. Selecting appropriate assessment methods, example, FBA, preference assessment. B. Administering specific assessment procedures as directed by the supervisor. C. Interpreting assessment results and developing recommendations. D. Deciding which behaviors or skills need to be assessed. Answer B. Administering specific assessment procedures as directed by the supervisor. This question clarifies the RBT's role in assessments. RBTs are implementers. While assessments are crucial, the responsibility for choosing which assessments to use. A. Deciding what to assess. D. Interpreting the findings. C. And making recommendations lies with the supervisor, BCBA/PCBA. The RBT's role is to carry out the specific assessment procedures exactly as trained and instructed by the supervisor, such as conducting a particular type of preference assessment or collecting specific baseline data for an FBA. You run the assessment procedure, but your supervisor designs and analyzes it. Question 5. A client has a behavior of saying water repeatedly throughout the day, even when they don't appear thirsty and water is available. They sometimes say it while flapping their hands. This behavior is likely maintained by A. Attention. B. Access to tangibles. C. Escape. D. Automatic reinforcement. Answer: D. Automatic reinforcement. This question presents a scenario designed to point towards automatic reinforcement. The key clues are that the behavior happens repeatedly throughout the day, and importantly, it occurs even when they don't appear thirsty and water is available, and sometimes paired with a self-stimulatory behavior, flapping their hands. This suggests the behavior isn't happening to get external attention, access to a toy/drink, or escape a demand. The verbal behavior, water, and possibly the hand flapping likely provide some internal sensory stimulation that reinforces the behavior itself. When a behavior persists without obvious external reinforcement, consider automatic reinforcement. Question 6. You are teaching a client to follow the instruction, stand up. Initially, you have to give them a full physical prompt to stand up. Over several sessions, you reduce the prompt to a light touch, then just a gesture, and finally, they stand up when you just say, stand up. This process of reducing prompts is called A. Shaping. B. Prompt dependence. C. Prompt fading. D. Stimulus control transfer. Answer: C. Prompt fading. This question asks about the process of reducing assistance when teaching. The phrase reduce the prompt is the direct clue, gradually decreasing the level of prompting as the learner becomes more independent is called prompt fading. Shaping reinforces approximations towards a target behavior, but here the target behavior, standing up, is consistent, the help is changing. Prompt dependence is when a client relies on prompts and doesn't learn independently. Stimulus control transfer is about the behavior coming under the control of the natural cue, the instruction, which happens as a result of successful prompt fading, but prompt fading is the process of reducing the prompt itself. Getting rid of the training wheels step by step is prompt fading. Question 7. What is the ethical term for treating clients with compassion, empathy, and respect? A. Confidentiality. B. Professionalism. C. Client dignity. D. Mandated reporting. Answer: C. Client dignity. This question is about an important ethical consideration beyond just following procedures. Treating clients with compassion, empathy, and respect directly relates to upholding their client dignity. This includes allowing choices when possible, speaking respectfully to and about them, respecting their privacy, which is related to confidentiality, and involving them in decisions about their care whenever appropriate. Confidentiality is about privacy of information. Professionalism is a broader concept encompassing many ethical behaviors. Mandated reporting is about reporting abuse/neglect. Dignity is about treating each person as a valuable individual deserving of respect. Question 8. Your supervisor asks you to implement a variable ratio, VR, 10 schedule of reinforcement for a client's correct responses during a teaching program. This means you will reinforce the client. A. For the first correct response after a 10-minute interval. B. Every 10th correct response. C. For the first correct response after an average of 10 minutes. D. After an average of 10 correct responses. Answer: D. After an average of 10 correct responses. This question tests your understanding of reinforcement schedules, specifically a variable ratio schedule. The VR stands for variable ratio. Ratio means reinforcement is based on the number of responses. Variable means that number changes unpredictably. The number, 10, indicates the average number of responses required. So, a VR10 means reinforcement is delivered after a varying number of correct responses, but that number averages out to 10 over time. Interval schedules, A and C, are based on time. Fixed ratio, B, is a set number of responses every time. VR schedules are like slot machines. You don't know exactly when you'll win, but it's based on how many times you pull the lever, response. Question 9. When should you update the graphed data for your client's programs? A. Only when the client shows significant progress. B. At the end of the day or session, as soon as possible after collecting the data. C. Whenever your supervisor asks you to do it. D. At the end of the week when you submit your timesheet. Answer: B. At the end of the day or session, as soon as possible after collecting the data. This question is about timely data management. Data needs to be entered and graphed promptly after collection, typically by the end of the session or day, to provide the most current and accurate picture of the client's progress. Waiting too long can lead to errors or delays in decision-making by the supervisor. Data collection and graphing are ongoing responsibilities, not just done when progress is significant or on a delayed schedule. Get that data put in right after you finish your session while it's fresh. Question 10. A behavior technician working with a client uses physical guidance, hand over handee, to help them put a toy in a box after being told, "Put in." The client puts the toy in the box. What is the behavior in this ABC sequence? A. Using physical guidance. B. Putting the toy in the box. C. The instruction, "Put in." D. The physical guidance prompt. Answer: B. Putting the toy in the box. This question asks you to identify the specific behavior within a described ABC sequence involving a prompt. The behavior is the action the client performs. In this scenario, the client's action is putting the toy in the box. The instruction, "Put in," and the physical guidance are both parts of the antecedent/prompting strategy that happened before the behavior. Using physical guidance is the technician's behavior, not the client's. The client's behavior is what you are teaching and measuring. Question 11. If a client cries and their therapist gives them a break from a non-preferred task, and the crying behavior increases in the future because of this, this is an example of A. Positive reinforcement. B. Negative reinforcement. C. Positive punishment. D. Negative punishment. Answer: B. Negative reinforcement. This is a classic negative reinforcement scenario, often confused with positive reinforcement or escape-maintained behavior. The behavior is crying. The consequence is the removal of the non-preferred task. Something unpleasant is taken away. Negative. The effect is that crying increases reinforcement. Therefore, it is negative reinforcement. The client is being reinforced for crying by escaping the task. Getting out of doing something they don't like makes them more likely to use that behavior, crying, again in the future to get out of other tasks. Question 12. You are planning to use a token board with a client. When should you explain to the client how the token board works and what they are working for? A. Only after they earn their first token. B. Before you start using the token board. C. At the end of the session. D. Tokens boards don't need explanation. The client will figure it out. Answer: B. Before you start using the token board. This question is about implementing reinforcement systems effectively. For a token board to work, the client needs to understand the contingency, what they need to do to earn a token, and what they can exchange the tokens for, the backup reinforcer. You should explain this clearly to the client before you start using the token board so they understand the expectations and the payoff. Starting without an explanation means the tokens might not be reinforcing. Make sure the client knows the rules of the game before you start playing. Question 13. A client screams loudly when you ask them to transition to a new activity. You observe that the screaming always stops when their parent comes over and says, "It's okay, you don't have to do that right now." What is the likely function of the screaming behavior? A. Access to tangibles. B. escape. C. Attention. D. Automatic reinforcement. Answer C. Attention. This question presents a scenario where the behavior's consequence involves a person's interaction. The behavior is screaming when asked to transition. The consequence is the parent coming over and talking to them. It's okay. While they do get out of the transition, the direct and immediate consequence from the parent is social interaction and verbal soothing. If this social interaction reinforces the screaming behavior, making it more likely in the future, the function is attention, even if it results in getting out of the task. Sometimes behavior has multiple consequences, but you look for the one that is most consistently maintaining the behavior. Here, the parent's interaction is the immediate and clear consequence. Question 14. Which type of graph is most commonly used in ABA to show a client's progress on a specific behavior or skill over time? A. Bar graph. B. Scatter plot. C. Line graph. D. Pie chart. Answer C. Line graph. This question asks about the standard type of graph used to track behavior change. Line graphs are the most common way to display data in ABA because they clearly show trends over time. The x-axis represents time, sessions, days, dates, and the y-axis represents the measure of the behavior, frequency, duration, percentage. This allows you to easily see if the behavior is increasing, decreasing, or staying the same across sessions. Bar graphs compare different items/conditions, scatter plots show correlations, and pie charts show parts of a whole. Line graphs are the standard for visualizing behavior change over time. Question 15. You are implementing a new program. You present the instruction, STI, but the client does not respond within 3 seconds. According to the program, you should then provide a gestural prompt. This 3-second waiting period before prompting is called A. Interresponse time, IRT. B. Latency. C. Prompt delay. D. Response interval. Answer C. Prompt delay. This question introduces a specific term related to prompting procedures, the waiting period between the instruction, STI, and the delivery of a prompt is called a prompt delay. This procedure is often used to fade prompts and give the client an opportunity to respond independently before help is given. IRT is the time between two behaviors. Latency is the time between the instruction and the start of the client's response. Response interval isn't a standard ABA term for this. A prompt delay gives the client a chance to respond on their own before you jump in with help. Question 16. What is the most important reason for using objective behavioral definitions? A. They are easier to collect data on. B. They allow different people to measure the same behavior consistently. C. They provide insight into the client's thoughts and feelings. D. They satisfy insurance company requirements. Answer B. They allow different people to measure the same behavior consistently. This question emphasizes the primary benefit of objective behavioral definitions. A good objective definition, like hits head with open hand, means that any RBT or observer watching the client will agree on whether or not the behavior occurred, because it describes exactly what to look for in observable, measurable terms. This consistency in data collection is essential for accurate tracking of progress across different therapists and sessions. While they might be easier to collect data on sometimes, A. And needed for funding. D. Their core purpose is ensuring reliable measurement by multiple people. They don't give insight into feelings. C. Objective definitions ensure everyone is on the same page about what the behavior is. Question 17. You are working with a client on a matching program. You say match, STI, present a picture of a cat, sample stimulus, and the client places it on top of an identical picture of a cat among other pictures. Target behavior. Reinforcement follows. This type of skill is primarily A. Imitation. B. Listener responding. C. Discrimination. D. Visual perception match to sample. Answer D. Visual perception match to sample. This question asks about a specific type of visual discrimination task. The scenario describes presenting a sample stimulus, picture of a cat, and having the client match it to an identical item among distractors. This procedure is specifically known as visual perception match to sample, VPMTS. It's a key type of discrimination training focused on visual matching. Imitation is copying actions. Listener responding is following verbal instructions to identify items. Discrimination is a broader concept, but VPMTS is the specific name for this matching procedure. When you match a sample to an identical item from a set, that's VPMTS. Question 18. What is the main ethical concern if an RBT accepts an expensive gift from a client's family? A. It could create a conflict of interest and blur professional boundaries. B. It shows the RBT is not providing effective services. C. It means the RBT will have to give the family a gift in return. D. It is never allowed under any circumstances. Answer A. It could create a conflict of interest and blur professional boundaries. This question addresses the ethical guideline regarding gifts. Accepting gifts, especially expensive ones, from clients or their families is discouraged and often prohibited by ethics codes and company policies. This is because it can create a dual relationship, therapist and friend/recipient of gifts, compromise objectivity, potentially influence clinical decisions, and blur the necessary professional boundaries between the RBT and the family. While many companies have a strict no-gift policy, making it possibly true in practice, the reason for the guideline, the ethical concern, is the conflict of interest and boundary issue. Keep your relationship professional, not based on favors or gifts. Question 19. When implementing a reinforcement schedule, consistency is key. If multiple RBTs work with a client, who is responsible for ensuring the reinforcement schedule is applied the same way by everyone? A. The RBT collecting data. B. The client's parent or guardian. C. The supervising BCBA or BCABA. D. The RBT who started the program. Answer. C. The supervising BCBA or BCABA. This question emphasizes the supervisor's role in ensuring consistency. While RBTs are responsible for implementing the plan, the supervising BCBA or BCABA is ultimately responsible for designing the plan, training the RBTs, monitoring implementation, and ensuring that all team members are applying the procedures, including reinforcement schedules, consistently and correctly. The supervisor provides the training and oversight needed for treatment integrity. Your supervisor makes sure everyone is on the same page and doing things correctly. Question 20. You are working with a client on a shaping procedure to increase the volume of their voice. What are you reinforcing? A. Any instance of the client talking, regardless of volume. B. Only instances where the client speaks at a normal volume. C. Sounds or words that are slightly louder than previous ones, gradually requiring louder responses over time. The absence of quiet speaking. Answer. C. Sounds or words that are slightly louder than previous ones, gradually requiring louder responses over time. This question asks how shaping is applied to a specific behavior dimension, volume. Shaping involves reinforcing successive approximations, behaviors that are closer and closer to the target behavior. If the target is normal volume, and they currently speak quietly, you would start by reinforcing speech that is just a little bit louder than usual. Once they do that consistently, you'd only reinforce sounds that are even louder, and so on, gradually shaping the behavior towards the desired volume. You are reinforcing improvements in the behavior's form or intensity. You reinforce little steps towards the big goal. Question 21. What is the main ethical responsibility when using punishment procedures? A. To ensure the punishment is strong enough to immediately stop the behavior. B. To use punishment as the first line of intervention for any challenging behavior. C. To ensure the client's safety and right to effective treatment, and to use the least restrictive procedures necessary, with supervisor oversight. D. To obtain written consent from the client themselves before using punishment. Answer: C. To ensure the client's safety and right to effective treatment, and to use the least restrictive procedures necessary, with supervisor oversight. This question addresses the serious ethical considerations around punishment. Punishment procedures have potential risks and should only be used carefully and ethically as part of a larger plan under strict supervision. The key ethical principles are protecting the client's safety and rights, prioritizing effective interventions, using the least intrusive or restrictive methods possible. Punishment is typically more restrictive than reinforcement/extinction strategies, and ensuring close supervisor involvement. Punishment should rarely, if ever, be the first thing tried. B. Doesn't necessarily stop behavior immediately. A. And consent is typically obtained from parents/guardians for minors, not the client themselves. D. Client well-being and effective ethical practice are paramount. Question 22. You are asked to collect data on a client's hair pulling behavior using momentary time sampling. You check every 5 minutes. If the client pulls their hair at 2:03 p.m., 2:04 p.m., and the check occurs at 2:05 p.m. while they are not pulling their hair, how would you record the data for that interval? A. Record 3 instances. Frequency. B. Record yes. Partial interval. C. Record no. Momentary time sample. D. Record no. Whole interval. Answer: C. Record no. Momentary time sample. This question tests your understanding of the specifics of momentary time sampling. The crucial detail is at the exact moment the timer beeps, which in this case is 2:05 p.m. Even though the behavior occurred earlier within the interval, 2:03 to 04, momentary time sampling only cares if the behavior is happening at the precise moment of the check. Since they were not pulling their hair at 2:05 p.m., you record no for that interval. Frequency counts every instance. Partial interval would mark yes if it happened at all. Whole interval would require it to happen throughout. Momentary time sampling is a snapshot at the end of the interval. Question 23. When writing a behavioral definition, it must be A. Subjective and include feelings. B. Functional and describe the consequence. C. Objective, clear, and measurable. D. Based on anecdotal reports. Answer: C. Objective, clear, and measurable. This question revisits the importance of defining behavior correctly. An effective behavioral definition must be objective, based on observable facts, not opinions, clear, easily understood by anyone, and measurable, you can count or time it. Subjective descriptions, A. Or relying on anecdotes, D. Lead to inconsistent data. While understanding the function, B. is important for the behavior plan. The definition itself describes what the behavior looks like, not why it happens. Stick to what you can see and count when you define behavior. Question 24. What is the best way to ensure you are implementing a new program correctly according to your supervisor's instructions? A. Watch a video of someone else implementing it. B. Read the written program steps carefully, ask your supervisor any questions, and practice with them if possible. C. Implement the program based on your best understanding and adjust as you go. D. Ask a more experienced RBT how they run the program. Answer: B. Read the written program steps carefully, ask your supervisor any questions, and practice with them if possible. This question emphasizes the importance of training and supervision. The most reliable way to learn and implement a new program correctly is to study the actual written instructions from your supervisor, clarify any points of confusion directly with them, and ideally, practice the procedure with your supervisor, observing and providing feedback. Watching others, A, or asking peers, D, can be helpful, but might pass on inconsistencies or errors. Implementing based on a guess, C, is not recommended. Go directly to the source, your supervisor and the written plan, for accurate training. Question 25. Your supervisor asks you to conduct a preference assessment using a multiple stimulus without replacement. MSWO. Procedure. After each item is chosen by the client, what happens to that chosen item in the next trial? A. It is immediately given to the client as reinforcement. B. It is put back in the array for the next choice. C. It is removed from the array for the rest of the assessment. D. It is briefly given, then put back in the array. Answer: C. It is removed from the array for the rest of the assessment. This question tests your knowledge of a specific preference assessment method. The key part is without replacement. In an MSWO assessment, a set of items is presented. When the client chooses one, they might get to interact with it briefly, but crucially, that item is removed from the selection set for all subsequent trials. This forces the client to choose from the remaining items, creating a hierarchy of preferences. With replacement, MSW would put the item back. So, without replacement means once chosen, it's out for the rest of the assessment.